Hey everybody, this is Dr. Kyle with Columbia River Chiropractic, bringing you your next tip for Tuesday. If you've been following along with our videos, you've probably heard us talk very frequently on foot issues and foot injuries. Today is no exception. We're going to cover something I haven't discussed yet. This is called a Mortons Neuroma, and can be something that can be quite painful and debilitating for many people suffering from it. Very similar in regards to plantar fasciitis, which you've heard me cover quite a bit in some of our videos, in that the pain that you have in your foot can really be debilitating and can really affect your life and quality of life in general. So what a Mortons Neuroma is, we have these spaces in between our metatarsals, these bones, so they call this our intermetatarsal space, that we have nerves that go through. They're sensory nerves. And very often what happens is if these nerves get irritated for a long enough period of time, what our body will do to protect itself is throw down tissue that kind of binds and adheses to that nerve to protect it. But the problem is this can help promote an environment that creates more inflammation around that nerve and can cause some very painful symptoms. Usually people that are experiencing a Mortons Neuroma will describe kind of pain when they're going through the toe-off portion of their gait cycle, or if they're wearing tight shoes, they'll feel kind of a burning, maybe a sharp pain around this area of their foot. Sometimes if it's a little more mild, people might describe that they're just experiencing maybe like they have a rock in their shoe, but there's really no rock to be seen. Either way, something that's obviously not ideal, and something that I think from our perspective we can help with. Especially because if you consider the typical treatment for a Morton's Neuroma is usually a series between corticosteroids, maybe some anti-inflammatories, and if it gets serious enough, they might actually do a surgical procedure where they remove some part of that nerve. And in my opinion, none of those things are really addressing the underlying cause. So typically what we'll do in our clinic is work on adjusting these metatarsal bones to make sure there's plenty of space in there to take pressure off those nerves. And then making sure that we address the dysfunctional arch, usually in the midfoot, and sometimes around the ankle and the heel joints as well. We usually prescribe some exercises to kind of address the underlying dysfunction, and if we encounter some stubborn cases, which we do from time to time, we have some other options like cold laser therapy, Graston therapy that kind of can get in there and help calm down that inflammation even more. But what I'm really trying to get across to you guys is the important piece of this puzzle is making sure that you're addressing the underlying cause, which is ultimately a dysfunctional foot, rather than just trying to address where you're having your pain. So hopefully that helps give you guys a little more insight, maybe a little more education in regards to what a neuroma or a Morton's neuroma is in the foot. And if you know anyone suffering with this pain, or you yourself is suffering with this pain, please don't hesitate to get a hold of us and see if we can't help you out. Again, I'm Dr. Kyle with Columbia River Chiropractic. Thanks for watching.